ये जो इंडिया है ना, it now has 11 lakh COVID-19 cases. Now imagining this big bucket to be India, let's see how these smaller containers, which are our various states and mega cities, how have they handled the pandemic? If the water that I pour into them doesn't overflow, that means they're doing fine. If the water overflows, it means they're not coping. Now we took a look at the period between 15th June and 20th July. This here is Bangalore. Just 700 cases on 15th June, 25,000 cases in a month's time. It is struggling. This here is Hyderabad. 3,400 cases in June, 30,000 cases now, struggling. Delhi, this is Delhi. 42,000 cases then, 1.2 lakh cases now. Simply not able to handle all these cases. And none of these cities have really been able to contain the growth of cases. Their hospitals, the administration there, they've all been overwhelmed. Okay, now let's look at some states. This here is Tamil Nadu. 44,000 cases on 15th June and 1.6 lakh cases now. This is Andhra. Andhra has gone from 6,000 to 40,000 now. Okay, this here is Bengal, from 11,000 to 38,000. And on top of the charts, this here is Maharashtra, that went from 1 lakh to 3 lakh cases in the last 1 month. Across India, the same story. 85,000 cases 2 months ago, 3.3 lakh cases 1 month ago, over 11 lakh cases today. In fact, we added 5 lakh cases in just the last 18 days. And this is what that looks like. India's healthcare system completely swamped by this flood of cases that is just not slowing down. For the rest of the video, let me return to my office. As you can see, it's empty. The Quint will be in almost 100% work from home mode for the next 1 year. Why is that? Main reason, India has not yet flattened the corona curve. Despite having one of the world's harshest and longest full lockdowns, despite thali bajana, candle jalana, we are adding almost 40,000 cases a day. And barring Mexico, India is also now seeing the most deaths every day. Close to 600 deaths daily. With over 27,000 deaths so far, in a few days, India will go past Spain, France and Italy. In April, we were calling these countries failed states. We were saying, thank God we're not in Spain or Iran. But we've left them way behind now. To those who say our fatality rate of 18 per 1 million is lower than Spain, France and Italy, I say, why not compare us with Japan's fatality rate of just 8, with South Korea's of just 6, Malaysia and New Zealand who are at just 4, or Thailand that's at 0.8, or why not Vietnam, which has not recorded a single COVID-19 death so far. Why aren't we Vietnam? Or even, why isn't all of India like Kerala, which has seen just 40 deaths? Just 40 deaths in all these months. What mistakes did the rest of India make? And are we still making those same mistakes? Our big mistake number 1, low testing. We never tested enough even when the pandemic started, meaning we failed to identify thousands of positive cases before they passed the virus on. And over 2-3 months, those thousands became lakhs of cases. Even now, our testing rate of 10,000 per million is way behind others. Iran's testing rate is 25,000, South Africa 40,000, Turkey 50,000, the USA 150,000. What's worse, the testing rate for huge states like UP, Jharkhand, Telangana is below 5,000. That is half the national average. The result of this is clear in Telangana, where cases have shot up from just 5,000 in mid-June to 45,000 now. Bihar's testing rate is just 2,600 per million. That is 1/4 of the national average. We're talking about 9 crore people. Because of such low testing, Bihar simply doesn't have enough data about the spread of the virus. It cannot predict where its pandemic is headed. So naturally, Bihar is again under full lockdown till 31st July. But surely we can ask Nitish Kumar, if Tamil Nadu's testing rate can be 22,000, why not Bihar? Why must people bear the economic hardships of repeated lockdowns because the government fails to do its job? Big mistake number 2, not adding enough health infrastructure during the lockdown. Dr. Srinath Reddy, President of the Public Health Foundation of India and a member of the National COVID-19 Task Force, says, "We did not utilize the lockdown to prepare our containment strategy for effective implementation on the ground. Hospital readiness should have been at a higher level." Sujata Rao, former Central Health Secretary, has said, "The government had 2 months' time. I am surprised they did not utilize that to ramp up their delivery system." Several states lacked specialized tertiary hospitals. They lacked well-equipped district hospitals, and this is costing lives. Add to that India's chronic shortage of doctors, of nurses, of health workers that could of course hardly be addressed in a few weeks of lockdown. Big mistake number 3, giving up on contact tracing and isolation. Dr. Shahid Jamil, virologist and CEO, Wellcome Trust DBT India Alliance, says the central and most state governments did not follow contact tracing and isolation on a war footing. An army of ground-level health workers was needed. Sensibly designed tracing apps could have been used, but none of this was done. The babudums of most of these states could not shake out of their decades of laziness and allowed numbers to soar. In many states, isolation and quarantining was done without empathy. Brute force was used. Facilities were poor. Livelihood concerns were ignored, leading to mass evasion. So naturally now, the numbers are just rising by the day. Big mistake number 4, post-lockdown public apathy. Here, ordinary citizens like you and me are to blame. There are enough pictures, enough videos shot in public places across India that show how many of us have given up social distancing, are not wearing masks, are not sanitizing our hands or surfaces and objects that we commonly use. Maybe some of these people are desperately needing to get back to work to survive economically. Maybe it's fatigue from following all the many lockdown rules. But in large part, it is a failure to grasp, even now, the seriousness of the pandemic and how simple, inexpensive, doable precautions can hugely protect us all from corona. Big mistake number 5, not driven enough by science and scientists. Dr. Matthew Verghese, public health expert who led India's efforts against polio, says India must follow data and must follow medical science to guide its COVID-19 strategy. For example, look at ICMR's recent announcement that Covaxin, the vaccine developed by Bharat Biotech and ICMR, will be ready for sale by 15th August. With Covaxin only in its phase 1 of human clinical trials at the moment, that is a completely unscientific assertion. Perhaps it was made under political pressure. But for ICMR, that is leading India's anti-COVID battle, to ignore science in such a manner is worrying. Dr. Verghese also underlines the need for district-level empowerment, for local-level health officials to use knowledge of local medical conditions and customize medical solutions accordingly. This is roughly what was allowed to happen in a state like Kerala. Ye jo India hai na, it has already lost thousands of lives that it could have saved. The pandemic has thrown up several learnings. Ignoring those lessons could cost us many, many more lives. And surely none of us want that.